Hello everybody, I'm Dr. Arpitha Komanapalli and I'm glad you're watching this video. In this video, I'll be talking about cortisol. Cortisol is often called the primary stress hormone. It's one of the main hormones we release when we are under any sort of pressure and our evolutionary based flight or fight response sets in. While producing cortisol is a necessity for life and helps to keep us motivated, awake and responsive to our environment, maintaining abnormally high circulating cortisol levels can become dangerous and contribute to long-term problems. The adrenal gland, following signals from the hypothalamus and the pituitary gland, is responsible for the secretion of cortisol, a type of essential steroid hormone. Cortisol levels are highest in the morning around 7 a.m. and lowest at night, called the diurnal rhythm. Cortisol is also present in both chronically stressed individuals and those who are perfectly healthy. This vital hormone possesses many purposes within the body and makes numerous chemical interactions every single day. So what does cortisol do exactly? Cortisol serves different functions, including helping us to keep awake and alert, preventing fatigue or brain fog, keeping our metabolisms running. It helps us burn fat for energy, balancing blood sugar levels since it allows cells to take up glucose for energy, reducing inflammation and helping with healing, balancing fluid levels based on salt and water intake, contributing to control over blood pressure, helping with many cognitive processes like learning and memory formulation. It also allows us to respond to and escape perceived dangers, helping to develop the fetus during pregnancy. So, symptoms of high cortisol level. According to research, the long-term danger of having high cortisol is that it temporarily shuts down normal reproductive, digestive, and immune functions. The body targets these systems for shutdown because it doesn't need them for immediate survival. Here are some signs that may signal you are living with high cortisol levels. These include weight gain, especially around the abdomen or stomach. This can happen despite not changing your diet or exercise routine. A puffy, flushed face, mood swings, increased anxiety, fatigue, like including feeling tired but wired, trouble sleeping, normally irregular periods and fertility problems, high blood pressure levels, acne or other changes in the skin, high rates for bone fractures and osteoporosis, muscle aches and pains, changes in libido due to changes in estrogen or decreased testosterone, and also excessive thirst, increased urination, higher susceptibility to infections are some of the signs. So what are the causes of these high cortisol levels in our body? Cortisol tends to go up as perceived stress goes up. So anything that triggers a negative mind states, things like anxiety, worry, anger, or frustration, contributes to high cortisol levels. Even medication use, inflammation, poor sleep, and poor diet can also trigger high cortisol levels by altering hormone balances and negatively affecting the immune system. Aside from steroids, other major factors contributing to higher cortisol production include depression, over-exercising or overtraining, nutrient deficiencies, addictions to alcohol or drug abuse, higher than normal estrogen levels, malnourishment and eating disorders, severe kidney or liver disease, hyperthyroidism, obesity, pregnancy or birth control pills, or any recent surgery, illness, injury, or whole body infection which triggers inflammation. So here is the way to test and diagnose high cortisol levels. If you have abnormally high cortisol levels, both blood and urine testing helps reveal the problem. A 24-hour urine test is used oftenly to recognize or diagnose this problem. So this vary depending on the time of the day, age, and type of cortisol test performed. Saliva test also now recommended to be a reliable more than a blood sample. Additionally, an overnight dexamethasone suppression test may also be recommended, and it involves taking a dose of corticosteroid medicine called dexamethasone to determine how blood cortisol is affected. Because of this, you will always need to evaluate your results in light of your specific symptoms and medical history. So normally cortisol ranges for adults and children in the morning are between 5 to 23 micrograms per deciliter or 138 to 635 nanomoles per liter. And normal cortisol ranges for adults and children in the afternoon are between 3 to 16 mcg or 83 to 441 nanomoles. Normal cortisol for newborn baby is between 2 to 11 micrograms per deciliter or 55 to 305 nanomoles per liter. So you can greatly help manage cortisol levels and regain your health by changing your diet, exercise routine, sleep and stress levels. So here are few steps you can take to help lower your cortisol levels. Switch to whole foods anti-inflammatory diet is very helpful in this. Poorly managed blood sugar levels and high levels of inflammation can contribute to cortisol levels and other hormonal imbalances. So following an anti-inflammatory diet low in processed foods and high in antioxidants, fibers and essential nutrients is key to balancing hormones, controlling your cravings and getting you on the right track. Some of the most significant dietary contributors to inflammations and high cortisol levels include high sugar or high glycemic diet with many packaged foods, refined grains, sugary drinks and snacks, consuming high amounts of refined and trans fats, drinking too much caffeine and alcohol, experiencing insufficient intake of micronutrients and antioxidants, not consuming enough fiber, which makes it hard to balance the blood sugar, not consuming enough healthy fats or proteins, which can lead to hunger, weight gain, high blood sugar. So instead, switch to a low glycemic diet, including healthy fats and proteins with every meal, and make sure to get enough fiber and phytonutrients by eating plenty fresh fruits and vegetables. Some of the most useful foods for lowering cortisol and stabilizing your blood sugar levels include vegetables, fruits, coconut or olive oil, nuts, seeds, lean proteins like eggs, grass-fed meat, probiotic-rich foods like yogurt or cultured vegetables. Reduce and manage stress. Chronic stress is now linked with just about every health problem out there. Stress affects most problems at some degree and impacts health by sending chemical signals around the body, including to your heart, blood vessels, immune system, lungs, digestive system, sensory organs, and brain. So stress has the power to increase breathing, increase your heart rate, muscle pain, muscle tension, your appetite, like including overeating and sleep-related problems. So the natural stress relievers are proven to help lower cortisol and decrease the negative impact stress has on your health. Some of the ways like meditation or mindfulness. This practice has been shown to help train the brain and body to turn off the response of stress and promote relaxation. And these benefits are possible without impairing concentration or memory. Many studies show that daily meditation or even healing prayer for just 15 to 30 minutes can offer significant reduction in cortisol. Using meditative methods can also improve brain and heart health while boosting your immune system. Deep breathing exercises. Take deep breaths helps turn down the sympathetic nervous system and kicks in body's natural relaxation response by activating the parasympathetic nervous system. So diaphragmatic breathing is an easy technique to learn on your own and practice throughout the day to relieve muscle tension and anxiety. Spending time in nature or outdoors. Studies show that physical settings play a role in stress reduction, and being in nature is a well-documented way to promote relaxation. So try going for walks or run outside, especially barefoot running or walking, a practice called earthing. Spending time at the ocean, walking through the forest, gardening at home, or doing other things outdoors and away from technology to reduce anxiety. Exercise regularly. According to a research published by Harvard Medical School, regular exercise about 30 to 60 minutes most days of the week, depending on the intensity, is one of the best ways to manage stress and also balance hormones, sleep better, and normal metabolic functions like balancing blood sugar levels. So the key is to avoid overtraining and overexerting yourselves, which can actually cause even more cortisol to be released. Exercise benefits hormone levels because it temporarily increases adrenaline and cortisol production, It generally helps bring cortisol back down to normal levels afterwards. So this cycle helps your body handle stress better. This means the next time your stress hormones rise due to a threat, you should be able to lower cortisol levels more easily since your body becomes primed during this physical activity. Use adaptogens, herbs, and superfoods. Adaptogen herbs help naturally lower cortisol levels in several key ways. They help balance hormones, reduce inflammation due to their strong antioxidant, antiviral, and antibacterial effects, and they have natural antidepressant effects. They also lower fatigue and help balance BP and blood sugar levels. So many adaptogens such as reishi mushrooms and cacao have been used safely over thousands of years to promote better overall health with little to no side effects. Some of the adaptogenic herbs that can help lower cortisol are ashwagandha, astragalus, licorice root, holy basil, medicinal mushrooms including reishi and cordyceps. Try essential oils to promote relaxation. Similarly to adaptogen herbs, essential oils are also helpful for fighting stress and balancing hormones. These include lavender, myrrh, frankincense, bergamot, and contain potent active ingredients that have been shown to naturally lower cortisol, reduce inflammation, improve immunity, and help with sleep and digestive functions. So try inhaling some of the best essential oils for hormones, or use a diffusing technique at your home, making bath soaks or body washes using your favorite oil, or rubbing them directly into your skin when mixed properly with carrier oils like coconut or jojoba. If you're dealing with side effects of high cortisol like acne or bloated stomach, essential oils like lemon and peppermint can also help. Get enough sleep. Getting enough sleep helps us control cortisol production, but having high cortisol levels can make it hard to rest. So in people with normal circadian rhythms, cortisol levels rise during the early morning hours and then drop very low at night, prior to sleep and during sleep. People who develop high cortisol levels can wind up feeling the opposite. They might feel anxious at night but then fatigued during the day. So they can't sleep well at times they are supposed to. Ideally, you should aim for 7 to 9 hours of sleep per night to reset your circadian rhythms and bring back hormones to balance. I hope this information was helpful. Here is a scripture to meditate. Come to me, all who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls. For my yoke is easy and my burden is light. Matthew 11:28-30. Thank you so much for watching this video. And if this video was helpful, don't forget to share with your family and friends. I'll see you again in my next video.